This is Ryan Wojciechowski. This is my week 6 clinical learning activity for NG insertion and removal. So I have all my supplies in front of me here. We have our emesis basin, our water cup our client will be drinking from. Our pH paper is going to be in here. We have our tubing. I have my syringe in here, which we're going to pretend is the big one. I have my paper clip with no rubber bands, so we're just going to verbalize that. I have my pen light and my tape, and my gloves over here too. So upon entering the room, I would identify myself, and then I would, so I'd say, my name's Ryan, I'll be your nurse for today. I would then identify my patient with their 2 patient identifiers, so ask for their name and date of birth. I would assess if they were in any pain today, or if they had any allergies that we need to be aware of. I would then move on to explain the procedure to the patient. So I'd say that the doctor's asked for us to put a tube down to their stomach. Do they have any questions for us, and if they consent to this procedure? So we're going to say that they say yes to all of the above. So now we're going to provide our patient privacy within our room here. We have all of our objects on a clean surface in front of us. We're going to make sure that our patient is sitting in the high Fowler position and that the bed is going to be at our waist level. We're also going to bring down the side rail on the side that we're working on over here. So we're going to perform our hand hygiene, and we're also going to auscultate the patient's lungs and bowel sounds. We're going to say that the bowel sounds are hypoactive, which allows for us to continue with our procedure here. So now the first thing that we're going to do is don our clean gloves. So this is not a sterile procedure. Now we're going to get everything else ready and prepared. So we're going to start with our tape here. Hopefully it wants to work with me. Alright, so we're going to do 2 pieces of tape about 3 inches, and one of them is going to be split like a pair of pants right down the middle. Put that sorry, need a little extra work. I'm going to do another one just in case. I'm also going to do a little piece of tape for our marker for how far we're going to be inserting our tubing here. So now we're done with our tape over there. So we're going to prepare everything else. We have our emesis basin. We're going to have a drape for our patient to put over their chest. We have our pH paper here. Pull out our tubing here. Move this out of the way. Right. So the first thing that we're going to do is measure how far we're going to be inserting this into our patient's nose. So we are going to start from the tip of their nose, and then we're going to go around their ear, and then down to their xiphoid process. And so for the sake of this patient, we're going to say it's 45. So we're going to place our piece of tape marker here. Right. This wants to turn all weird. Alright, so now we're going to move this over here. We're going to place our emesis basin in front of our patient here. We're also going to place a drape over their chest here, just in case there is any leakage. Next, we're going to move on to asking them about their, have they had any surgeries on their nose? Do they have a deviated septum that they're aware of? Or have they ever broken their nose? If they say no to all those questions, we're going to then go ahead and look inside and look at the patency of their nostrils, and both of them look clear and patent. So we'll say for the sake of this demonstration, we are going to use the right nostril here. So we use the right nostril. So now we are going to insert our syringe into our tubing here. We're going to do this ahead of time just in case there is any leakage of the gastric contents. We want to make sure that we're prepared for that. And then we're also going to dip our the end of our tubing here into our lube. We're going to give a generous amount to our client just because we are sticking something up their nose and it is going to be uncomfortable. So now at this point, I would have my client tilt their head backwards. I'm going to have my hand behind their head. I'm going to begin the insertion. I'm going to keep going. They'll probably be coughing and gagging this whole time. And then right around here, I would have them tilt their chin down to their chest, and they're going to be drinking the water the whole time. So I'd tell them to drink, 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 still going up until we get to my tape marker here. So now we've reached this marker, so I'm going to remove the tape so it doesn't go into the client's nose. We're also going to use our pen light. We're going to have the client open their mouth, make sure that the tubing isn't wrapped around their tongue or anything. And then now we are going to secure it to our patient's nose. So we're going to use our tape that we split like a pair of pants. We're going to make sure that we're holding this tubing the whole time until it is completely secured. So we're going to wrap these around. So this one's going to go underneath here, just like that. And this one's going to go underneath like that. So now that it is secured to our patient's nose, we're going to be able to let go of that. So we've already checked, made sure it wasn't wrapped around or anything. We could also take bowel sounds and lung sounds at this point again if we would like. So now we can move on to the removing of some of the gastric contents. So we're going to have our syringe here. We're going to remove around 5 mLs of gastric secretions, making sure we're holding it up like this. We're going to take it out here, and then we're going to test it on our pH paper. So we're going to do about a drop or two onto the pH paper, and we want to compare it with our the charting for it, and we want it to be around 3 or 4. Not around, we want it to be 3 or 4. So now the rest of our gastric juices, we're going to insert back in here. Make sure we get all that in. And then now we're going to remove this, and we're going to insert around 20 milliliters of air in order to clear the rest of the gastric secretions out of our tubing here. So we're going to insert this here. We're going to push the air down in. All right, so now we push the air through. We are going to be able to connect our connector back here. Secure this here. So now this is all closed up. We want to attach this to our client's gown. So we're going to use our paper clip and rubber band here. So just like the Foley catheter, we want to attach it to their gown somewhere that they're able to turn their head left and right and not have it be pulling on them. So I'm not able to connect it to anything. So I'm going to verbalize that we would connect this paper clip onto here and get it attached to their gown. And so once that's attached and they have their range of motion, our patient is going to be able to go down to X-ray now. So then we'll say a few days later, the doctor asked for us to remove the NG tube. We would enter the patient's room, introduce ourselves, ask for the 2 patient identifiers, so ask for their name and date of birth, assess if they're they have any allergies or if they are in any pain today. We're going to explain that we're going to be removing the NG tube from their nose today, and ask if they have any questions and if we can proceed with the procedure. So once we do that, we are going to perform our hand hygiene. We can also take lung sounds and bowel sounds and don a new pair of clean gloves. So we've done the hand hygiene and new gloves. So now what we're going to do is remove our paper clip from our client's gown, have it hanging down like this. And the next thing we want to do is take so we're going to take our clean syringe and we're going to fill it with about 20 mLs of air. And then we're going to push that into our tubing. And that's to make sure that any gastric contents that may have been left in the tubing is going to be flushed out. So now that that's all done, we can insert this back here. We're going to remove the tape from our, set this down for a second. We're going to remove the tape here. If this wants to come off for me. Alright. So now we've removed all of the tape around this area. We flushed it with the 20 milliliters of air to get all the gastric contents out. So we're going to place a towel or something underneath our patient here. We're going to ask them to hold their breath for a few seconds, and then we're just going to pull, and it's out. So now at this point we would dispose of all of our materials in the appropriate receptacles. We would take off our gloves and perform our hand hygiene. We would make sure that the patient's bed is going to be in the lowest position, the side rails are up, they're in a comfortable position. Make sure that their call light's within reach, assess their comfort and pain level at this point. And then we would perform our hand hygiene on our way outside, out of the room, and then we would document what we did today.